Bismillah ar-Rahman ar-Rahim. Good afternoon. Assalamu alaikum. I'm Dr. Ahmed Dabbar, the Director of Technology Transfer and Partnership at Sharjah Research Technology and Innovation Park. Sharjah Research Technology and Innovation Park is doing a lot of webinars in terms of the technology enhancement and technology transfer and commercialization. And this time we cleanly choose the topic of biomedical and biosciences engineering for different reasons. The first reason is we have seen the huge importance of these two fields during the COVID-19 pandemic. And as you know all, a lot of invention, a lot of new ideas surrounding the whole world, from universities, from private sector, from government, from hospitals, to find effective solutions to fight against the COVID-19 and the coronavirus. Of course, this big fight, it's not coming from nowhere. It's coming from the great concept of innovation and the commercialization of universities and research centers around the world. And also we have seen the importance of material development and the importance of the 3D printing during the pandemic, where we used a lot of ideas to use this 3D printer for fast prototyping and also for production and deployment immediately in hospitals and the first front line. But let's talk first of all about what happened in United Arab Emirates. In a recent publication of the total measures taken by the United Arab Emirates government to contain the crisis of the new coronavirus outbreak, from its inception in March until the beginning of the gradual return in normalcy in June, more than 472 measures covered all health, economic, and social sectors. It's a lot of measures here. It proves that really the United Arab Emirates is going really to be the leaders of innovation ecosystem worldwide, or amongst the leaders worldwide. Here where this number occurs means we have a lot of measures happened during the pandemic. Now, I would like to concentrate only on the aspect of universities and research centers. 41 procedures from different universities are done to prepare innovative initiatives to fight the virus and to help the society during the crisis. Most of these innovations revolved around biomedicine and biomedical engineering that started from an idea through the development of prototypes with the aim of obtaining a product used to combat the epidemic and also to deploy it in the fastest way to hospitals and to the front line. This process highlighted the acceleration of the importance of biomedical engineering from the instrument point of view to the bioscience discoveries related to the development of drugs related to COVID-19. Let's give you some highlights on the actual development or the development happened during the pandemic from the different research centers in UAE. I will start, of course, because we are the host, I will start with the Sharjah Research Technology and Innovation Park. We developed face shield in cooperation with Imansa Labs with the high protective materials by using 3D printing technology consumed in mass production in different government entities. American University of Sharjah, they developed the sanitizer antibacterial. It's very efficient product done by the chemical engineering department in killing coronavirus and 100% safe for the human usage. And also the Department of Electrical Engineering, I think with the collaboration with other department, they started developing ultraviolet machines and ultraviolet wearables that can help the doctors and the nurse in the hospitals to wear something that it's 100% safe from the coronavirus. Another institution who did a lot of work during the pandemic is Khalifa University. They developed a radar to diagnose vital signs for individuals without direct contact. They developed a respiratory machine for emergency cases in 5 days and from local materials. They developed a project aimed at monitoring the presence of the COVID-19 virus in wastewater. The university also invented an innovative project called Twinkle Heart in cooperation with Khalifa Center of Innovation, and they also went beyond this one to create a startup to commercialize this product. They also worked on the record of the genome sequence of the virus that's in the future, it's possible to determine the full genetic footprint of the virus. Mohammed bin Rashid University of Medicine and Health Science in collaboration with the Dubai Health Authority, they went to the genome sequence development of the virus for at least 24 affected patients from different ages. UAE University, development of face mask provided by protective layers, and also they developed a device to allow people use the lift without using the doors and using the buttons. They developed a 3D printed doors arm set. NYU, they developed fast mask in 3D printing, which is equivalent and even more proficient than the N95 face mask. You see here, a lot of the development from the research centers has been done during the pandemic, but it is a prototype, it's an ideation, it is something that we test, deployed also to some real operation centers, but it needs a real effect of commercialization. And this is the aim of today's talk with this eminent professors. I think here, we did this during the pandemic, and what the next step? Okay, what's the advantages of the biomedical engineering? What the advantages of bioscience? Okay, how we can attract more students working on this project in the future? Okay, what we can learn from lessons we can learn from the pandemic, and we can avoid the mistakes for the future and give an evidence this way. Let me welcome Professor Hassan Nashash. Dr. Nashash, he's a professor and director of biomedical engineering, graduate program, and former chair of the Department of Electrical Engineering at the American University of Sharjah. The main themes of Dr. Nashash research work are in the general areas of neuroengineering, signal processing, and microelectronics. His research publications are in cognitive vigilance, assessment and enhancement, brain source localization and epilepsy, assessment of spiral cord and brain injuries, flexible implementable electrodes, and low power electronics devices. In addition, he designed and developed several electronic instruments to measure various biodynamics parameters. Welcome, Doctor.
Thank you, Ahmed. Thank you very much.
I would like also to welcome Professor Naveed Khan, who has over 20 years of experience of working in leading institutions in North America, Europe, and Asia, and currently holds the position of professor and head of biology, chemistry, and environmental science department at American University of Sharjah. Dr. Khan maintains a bold interest in all aspects of infectious diseases, winner of several valuable international awards. His research applications are in the area of cohort, brain, and other bioscience areas. Welcome, Doctor.
Thank you. Good to be here.
I would like to start with Dr. Hassan to present about the main research activities of the biomedical engineering at American University of Sharjah, and also about the future projects that he sees or he foresees this as a commercializable product, I think, in the market of this one. Afterwards, we will go with Dr. Naveed also to present us his research activities and the department activities. And after that, we'll go for some question answers between both, and we'll open the window to the audience to ask questions for this one. Welcome. Please, Dr. Hassan.
Thank you, Ahmed. Assalamu alaikum, everybody. Hope you're all healthy and well. And per Ahmed's instructions and recommendations, we have prepared the presentation. So I would like to, first of all, go over, our view on biomedical engineering and the importance of biomedical engineering. And then we will delve into some of the projects that we are working on here at the university with my colleague, Dr. Khan. So I think I will just push this button and hopefully it will show the screen. Is it showing okay?
Yes.
Okay. So first, I'll just go through the outline. And being an academic, we have to organize the presentation. So we'll just first look at the economic vision and science priorities of United Arab Emirates. And from there, we will go into the status of research and innovations in this field. And hopefully that will lead us to the importance of graduate level education in biomedical engineering. And then Naveed and myself will talk more about the active research projects, and maybe also later about future research projects as we mentioned earlier. A question that was raised by Ahmed when we started talking about this webinar: what is biomedical engineering? What do you really mean by biomedical engineering? And it turns out that many people actually, or there is a misconception about biomedical engineering, that it's just those technicians who are working in the basement of a hospital. And this is true to a certain extent, but actually biomedical engineers, they do far more than that. It's a multidisciplinary profession. It actually serves engineering, and it also serves biology and medicine. And so it's multidisciplinary. It integrates scientists, mathematicians, engineers, to solve problems in biology, as we said, understanding living systems. So you have people working actually with viruses and bacteria, same as biologists. We, as biomedical engineers, develop devices, develop algorithms. So although we work with the cell, we also develop computer algorithms that can solve certain problems or develop some material. So this is like the general overview or definition of the biomedical engineering. And I actually extracted some of the keywords here from IEEE Engineering in Medicine Biology Society. So, of course, this whole business of importance of biomedical engineering and biosciences came about after this COVID-19, and we saw the importance of biosciences and bioengineering during this pandemic. And from the time the patient feels unwell, measuring temperature, then doing tests, taking samples, you need an instrument to decide whether the case is positive or negative. And then if the patient or the person is positive, identified as positive and needs help, then they put this person on a ventilator. So it's really, when you think about it, the course support for this individual or this patient is based on the use of technology. Of course, in addition to this, we have witnessed in the past a tremendous rate of population growth in the MENA region. I mean, in the United Arab Emirates here, the country started with hundreds of thousands, and now we're talking about almost 10 million people. And this is not just the UAE, it actually goes to all of the other countries. So it applies to all of the other countries. Of course, this brought with it new types of challenges, more hospitals, more clinics, more research centers, more universities. With all of these, there are challenges. In April 2018, the Prime Minister of UAE announced what is called the UAE Advanced Sciences Agenda for 2031. And within this agenda, they have identified the high priority science objectives. And one of them, as you can see here in this slide, is treating the health challenges. And of course, this is from what I've been talking about earlier on. And in order to do this, in order to treat the health challenges, we really need to invest in the core, in building the core scientific competencies. What are these scientific competencies? There are many, but amongst them is the healthcare, or the integration between healthcare and biomedicine. So this is a clear message from the government that we need to invest in this direction. And if you monitor the number of attendees attending Arab Health in Dubai in the last 15 or 20 years, the number is continuously growing. And that actually reflects the interest in this field. You're talking about an exhibition or and conferences, of course, that is attended by more than 100,000 people every year. So what do biomedical engineers do? Well, as we know, they actually play a major role in the assessment of medical devices, management of medical devices, regulation, of course, of medical devices, but there is an element here that we feel that is underrepresented in this country. And let me just raise some of the questions which show the importance of the presence or the contribution of biomedical engineering in research. For example, what are the genetic variants that predispose GCC citizens to premature cardiovascular disease and or diabetes? In other words, questions like, why do we have like almost 20% of the citizens of this country and most of the GCC countries diabetic? What about the environment? What are the environmental and lifestyle factors associated with CVD? And can we improve the accuracy, for example, of breast and colon cancer? Questions like these, they require a more technical involvement rather than just a pure biology or medical involvement in research. When you start talking about developing new treatment methods, we do not always talk about drugs. Treatment methods may include a device, may include an algorithm that actually helps to treat subjects. For example, recently there was a call for rapid detection of coronavirus. In addition, of course, to trying to find the cure, rapid detection, we need to find a fast method, faster than the existing methods, which may take hours or a day to identify if this subject carries the virus or not. So these kind of questions raise the importance of research in biomedical engineering. And if you actually read also some of the websites concerned with available jobs, we are now witnessing new types of jobs that are advertised by universities. I mean, the American University of Sharjah in the last couple of years had many positions for postdocs, people who with PhDs to do research in biosciences and bioengineering. Now there are available positions at the Biomedical Engineering at Khalifa University for research associate, and the Khalifa Center for Biotech and Genetic Engineering, New York, Abu Dhabi. So now we are having more and more of interest in biomedical engineering research. And this means also, do we have the necessary expertise that are able to handle the challenges that we are after in this time? Well, I went and I actually looked at the statistics published by the R&D magazine survey. It's actually published in a document that was published 2019, and it shows the R&D as a percentage of the gross domestic product. This is on the x-axis, and on the y-axis you see the number of researchers and scientists per million of the population. And as expected, you see here right in the middle, sitting the United States, the blue circle, with almost 3% of their GDP spent on research and development, and with more than 4,000 scientists per million of the population. If you even stretch it further, you have Finland here, Finland, we're talking about a country with very harsh environment, maybe similar to UAE, but in a different way. They are spending 3.5% of their GDP on research and development, with more than 7,000 scientists and engineers who are willing to conduct advanced research. But sadly, I would say that we are still in the left side corner here. The green circles are the circles from countries in the Middle East. And this is a strong message saying, look, we need to invest more into developing the expertise, the talent, in order to be able to conduct advanced research and development, and in order to address our needs, our society needs, the needs that we've been talking about earlier on. So what is really what are the main limitations of research as we experience them? Every academic in this country used to experience this. Now the situation is much better, but one of the main limitations is the limited number of graduate level master and PhD programs. And what are these programs? Why are they needed? Well, obviously, we need to produce scientific knowledge. We need to generate knowledge. We need to disseminate knowledge. And this is done, as you know, by research. How to do this? Of course, professors at universities can conduct research. They can, but with their heavy load, teaching load, I mean, especially that most of our universities are teaching universities, I think we need to invest more into graduate level education. Luckily, there are a lot of master level programs, and we have already established one of the programs. I will talk about it in a minute. But we also need to invest more in establishing PhD programs. So the investment really, when we say we want to invest in the talent, I honestly think we need to invest in the PhD programs that are able to conduct advanced research. This is where this is the required talent. Now, the situation for the biomedical engineering at the undergraduate level, really, I think we are okay. This is just showing the number of programs in different countries. For example, in UAE here, we know there are two well-known programs, one at Ajman University, one at Khalifa University. There are 5 programs in Jordan. There are 5 other programs in Saudi Arabia. So I think at the undergraduate level, we're doing okay, and we're satisfying the market with the needed expertise. But when you look at now the master's level program, and in United Arab Emirates, three years ago, we had none. In fact, the whole GCC did not have Masters of Science in Biomedical Engineering. Of course, there are other programs embedded within other graduate programs, but full-fledged biomedical engineering programs were not that abundant. So now we have 2, one here at AUS, which started 3 years ago, and it was the first in the GCC, and now we have another one at Khalifa University. For the PhD programs, the situation is even more challenging. I mean, if you look here, in UAE, we have one program that's really related to biosciences and bioengineering. In Saudi Arabia, there is one. Qatar, we have one. In Lebanon. So there are really few number of programs. And I honestly think, I mean, the picture is clear. We really need to invest in this line in order to reach that status where we start talking about advanced research, new products, commercialization, etc. And maybe I'd like to share this picture with everybody. This is our first cohort of I call them the stars all the time because they were the first group of biomedical engineers, master's degree in biomedical engineering who graduated in spring 2019. And I'm happy to say also that we have developed a PhD in bioscience and bioengineering at the American University of Sharjah. And notice the title of the program, bioscience and bioengineering. So it mixes both of them, the science and the engineering. And this program has been approved by the Ministry of Education, and it's ready to go. And we're just waiting for the university to give us the green light, hopefully soon. Now turning into the healthcare challenges that facing us before even the coronavirus or COVID-19 virus. I mean, the different parts of the world, they have their own challenges, their healthcare challenges. But in this part of the world, the Middle East and the GCC, cardiovascular disease, diabetes, and injury, believe it or not, the second cause of death in GCC is mainly injuries. And the third cause of death is cancer. Of course, in addition to obesity and mental health. So these are very clear challenges that have a lot of opportunity for scientists and engineers to work on. So at our university, at the American University of Sharjah, at least in the Biomedical Engineering program, our identified active research areas are cardiovascular, cancer, brain and mental health, and healthcare systems management. And of course, we are also working on like supporting tools in artificial intelligence, NGS, robotics, transducers, developing new transducers and imaging and functional stimulation. I'll just go through some of the projects quickly, and then I'll give the floor to my colleague, Dr. Naveed. I'm not sure how, maybe I need to just quickly go through these. So I'll just mention the main research themes that we're working on, and then I'll turn to Naveed. One research team that is doing very well at the university is our ultrasound cancer research group. This is led by our colleague, Dr. Ghalib Husseini, who they are working on trying to reduce the side effects of chemotherapy in cancer patients using targeted drug delivery with ultrasound waves. It's a very interesting project, and it's also published on the website. Our research, our also neuroengineering research group, they're involved in several projects. Like source imaging. This is even collaboration with Rashid Hospital. Assessment of spinal cord injury. This has even international collaboration with Johns Hopkins. Cognitive vigilance assessment and assessment of brain injury. Here again, we're not developing devices, we're developing algorithms to actually quantify the various levels. And there is a lot of business opportunities here. Another group working with healthcare systems management, and they're using, by the way, Internet of Things, and then using also artificial intelligence into trying to help in the healthcare systems management. And another group working with imaging systems, for example, trying to develop a method to assess the usefulness or the usefulness of the treatment of vitamin D. I mean, vitamin D is being used as a treatment, but how useful is this? So one of my colleagues also is working on this. Another colleague actually working on early detection of breast cancer using mammography. And on the other front, we have sensors and devices. Here again, we have several people working, developing new sensors and new electrodes for various applications. Maybe I'll stop here and I will turn to my colleague, Dr. Naveed, to talk about the biosciences part.
Okay, thank you very much, Dr. Hassan, for a very comprehensive talk. Much appreciated. So my task is really to give you specific examples of what have we done, what was our response to COVID-19, and where I see the potential opportunities, business opportunities. Just briefly, before doing that, I just want to mention in the next slide that where do we stand in terms of innovation. If I can please go to the next slide. Yeah, so basically, as we know that UAE is doing fairly well. We are rated number 36 out of 129 economies. And I believe that following the COVID-19 outbreak, there is huge potential, especially in the area of biosciences. And that's what I want to focus on for today's talk. So in the next slide, I want to introduce our department. So our department is very multidisciplinary department. So we have faculty who are engaged in research in biology, in chemistry, and in environmental sciences. And our faculty, they work on genes, they work on proteins, they work on DNA, RNA, with the goal that how can we have an impact on our society, in our community, to solve problems which are important to our community, whether it's in the form of drug discovery, coming up with new drugs, new antivirals, new antimicrobial, whether it's related to environmental, biodiversity, and conservation, and how can we apply this knowledge and bring it to a pharmacy, bring it to the patient. And in the next slide, I will show you the existing research that's happening in the department. So we work in multiple dimensions. So from antimicrobial discovery to chemical technologies, we have faculty who are working on vaccine development, which is very much needed, as well as in biodefense and biodiversity and conservation. And in here, I see a lot of potential, a lot of opportunities that where we can commercialize the products that we have at our disposal, and that's where faculty are working on. In the next slide, I just want to highlight that, yes, at the moment, there's a lot of focus on COVID-19 and COVID-19 related morbidity and mortality, but we must not forget the burden of infectious diseases in general is there. So it's not just about COVID-19. More than 17 million people die every single year due to just top 10 infectious diseases. So I understand the urgency, the importance, but there are opportunities which are related to infectious diseases in other areas as well. So for example, respiratory infections, they do kill nearly 4 million people. HIV kill nearly 3 million. Diarrheal diseases kill nearly 2 million. TB more than 1.5 million. So we ought to be finding solution to many of these problems in addition to COVID-19. And that's where the focus has to be for future research. And this is despite our advances in antimicrobial chemotherapy and supportive care. So despite the discovery of antibiotics or antivirals, still more than 17 billion people are dying every single year. And we ought to be focusing on these infections as well as in addition to COVID-19. In the next slide, I want to show you very quickly about our departmental response to COVID-19. And I just want to highlight that our department is focusing on the treatment aspect, how we can enhance the treatment of COVID-19 related morbidity and mortality. And we were the first in terms of the department to propose that intranasal route is a potential mechanism by which we can deliver drugs to the CNS, to the brain. So in many cases, the seriousness of the disease is related to when brain is involved. And so we propose a new method, not just intravenous route, but also intranasal route to treat those infections. And we also in the next, we also showed that our groups are heavily engaged in informing the society, informing the community. We were among the first few groups to project that what is the clinical features of COVID-19, what were the diagnostic, present diagnosis and the future opportunities as well as pathogenesis and treatment options. We also highlighted among the very few groups to showcase that how this particular virus can invade the brain as well, can go to the central nervous system. It's not just limited to the lungs, but it can also affect other organs as well. So there's again offers a lot of opportunities to commercialize. And in addition to that, we focused our work in the department in disease transmission, that how there's a lot of the conception is that whether during the summer months the virus will die off, that may happen, but we also propose that we need to be mindful of the role of centralized air conditioning, air cooling units in the mall, in our homes, whether that can also contribute to the transmission of these viruses in the community, so leading to recurrence of infection per se. So that's again an important area of research that we need to highlight. So whether we can design and devise new products that can stop transmission, and to look at the role of centralized air conditioning, whether these can contribute to the transmission of infection. In addition to that, we also covered the environmental disinfection, and we propose novel strategies that how we can effectively kill these viral pathogen in the environment without affecting the ecosystem of the environment, without harming the other species that we have, which are beneficial to human and animal health, and for plants and for the environment. So we propose novel strategies, and I hope that these kind of areas we can bring to the market, and I believe that this can contribute majorly to our global effort in eradicating this menace, this particular problem. In addition to that, other areas that we are focusing on in the department is the discovery of novel, new antivirals. We are actually looking at new sources, new species. So with the kind of question we are trying to ask is that although this virus is affecting Homo sapien, which is us humans, but what about other species where this virus is, those species are thriving even in the presence of this particular virus? So, for example, how come some of the species, such as bats or cockroaches and other animals, other species, seems to be less affected by this virus, and Homo sapiens or humans are more affected by this? So, they must possess some potential novel antivirals to counter this threat, to counter this virus. So, how can we derive, how can we discover those antiviral from those species and use it to our advantage? Additional research, as pointed out by Dr. Ahmed and Dr. Hassan already, is in novel disinfectants. Again, the ones which do not harm or do not have any toxic effects on other species, but only affecting the virus, and the development of vaccines as well as modern medical procedures, and have lower effects on the human cells as well. So these are the kind of areas that we have been working on, and these are the areas that we believe offer a lot of opportunity in the future as well. Let me go on the next slide. So yeah, in here, I think well, we believe that we are working on areas which are very, very important and which can contribute majorly. However, I just wanted to highlight that it's the role of the institution to come up with these novel ideas, these findings, and then we have to work with the other colleagues, with the collaborating institutions, to ensure that we take it to the next level, that these discoveries do bring, are brought to the market for the benefit of the humankind. With that, I'll go to the next slide, please. Okay, I'll pass on to Dr. Hassan.
Maybe Naveed, you can also talk a little bit about our new project that we plan working on.
Okay, we have two projects we are at the moment we are executing. One is on the diagnostics, and the second is on the finding novel antivirals. So what we're trying to find out is that how can we design probes which can use the DNA or the genetic information of the virus, and combine that with the tools available with our faculty like Dr. Hassan, and then come up with a device that can detect the presence of a virus in the air. So it can be very, very rapidly identified. So we are working on that project, which will be very helpful, which I believe we can place, for example, in the mall, in the hospitals, in public places, and we can monitor the presence of this virus, whether how it is spreading, because it's not going to be one-off. In my personal opinion is that there could be a recurrence. So we need to be prepared that if there is a recurrence, how do we cope with that? How do we discover that there's a new outbreak in a particular community, in a particular setting within the city or within UAE? That's one project that we are working on at present. Another project that we are very keen, and we will be working on that soon, is finding these novel antivirals. And in here, what we're trying to do is that one of the mechanisms by which some researchers are trying to find out that whether we can look at places, garbage places, those areas where we can find out whether how the transmission happens in the community. So the question we're asking is that how come species which are thriving in those environments, such as cockroaches and those species, how do they cope with these pressures with this particular virus? Why doesn't this virus kill those kind of species, and it seems to be affecting Homo sapiens? So we are looking at that project to find out that maybe those species possess some potential novel antiviral compound that we need to find out, and then we need to discover them, and we need to synthesize them in our lab using expertise that we have in the department at our university. And then we then need to bring that to a pharmacy, bring that as a disinfectant, bring that as a tool to treat patient, bring that as a tool to diagnose this infection as well as potentially other infection as well. So that those areas I believe will be very beneficial, not just for COVID-19, but also in terms of taking this research and applying that in other infectious diseases as well.
Thank you. I can comment about these projects later on if necessary. Back to you, Ahmed.
Thank you very much. Thank you, Dr. Hassan. Thank you, Dr. Naveed. Now I will go, if I can take the lead in sharing. Yes, good. I think I received, that's why I have to go in a few slides, because I received a lot of questions about, I am biomedical engineer, I'm looking for a job. You know, I am a bioscience graduate and I am still fresh, how I can get a right job. You see that this type of competences, they are spread in the market, but with a little bit no value, because people, they don't see their value correctly. We have seen them during the pandemic, as I said, okay, but would like to see more and more and to have an emphasis. That's why I have to present to you the Sharjah Research Technology and Innovation Park to the audience to know who are we and how you can be beneficial for the park and for yourself. Sharjah Research Technology and Innovation Park is a very ambitious project created by His Highness Sheikh Sultan bin Mohammed Al Qasimi in 2016 by a decree to create a science park belongs to American University of Sharjah, which means it's owned by the American University of Sharjah. But to complete the picture of the aim of the American University of Sharjah in doing education and research, but here is doing applied research and commercialization, which means very close to the market than the academic side, which means here we are playing the middle level between the education institution and the market need and the competency. Here, it's located adjacent to the American University of Sharjah, I think, and you are most than welcome to come and to visit this very ambitious project. We have live projects are on the ground, like a 3D printed house. We have a 3D metal machine, one of the first sophisticated machine in the world. We have this very nice building that you see here is finished, and now it will be open officially in the first quarter of the academic year to host the most innovative companies and startups worldwide, and here to work in a very innovative ecosystem. And this innovative ecosystem, it has a strategy. This strategy is to build the innovation ecosystem for Sharjah and for the region and even internationally, and to grasp the knowledge and the expertise from the American University of Sharjah and from the academic city also, and from also academic institutions in the UAE, and take the leads here, the talents, identify the talents, either they create their own startups or they can benefit from the actual startup setup in the park to be hired as a talent and to work in innovative projects. To catalyze to the economy, knowledge economy, as you know, that UAE adopted innovation ecosystem and innovation strategy from 2014. And here, this project will really contribute to the GDP of the country from the knowledge-based economy. At the end, invest for the future, which means here we are looking for new technologies to implement, and new startups, a new mindset, and new talents coming from universities, instead of asking that I am fresh and I would like to work, please find me a job. No, I would like to ask him, be an entrepreneur, be yourself to create your business, be your innovator, and come to this research park, and you will be helped by Dr. Hassan and Dr. Naveed from the academic point of view and from the research point of view, and helped by the science park in creating your business from gradually from zero to, I hope, a unicorn company worldwide. And this is exactly the aim of the complete picture here. The main sectors that the science park is working on this one is the sectors linked to the competences and the strength of American University of Sharjah and other universities in the university city. Water technology, environmental technology, renewable energy, which means the green technology. And you know, all of us, we know the importance of the green technology and the implementation of the green technology in the UAE and even the region. Digitization, that we are in the era of the fourth industrial revolution, and here technology enhancement and technology creation is the must and is the pillar of success of any business for the future. Mobility, logistics, and transportation. Here we have different technologies like the hanging train, if you have seen it, I think here in the park, and they are building the 3 kilometer demonstration and prototype, and you will see really an amazing demonstration, unique in the world here in the science park. And at the end, the production design architecture here, where we see the importance of smart manufacturing, 3D printing, and also architecture. And here we have seen the importance of the demand chain compared to the supply chain. To be honest with you, supply chain show a big weakness during the pandemic. Why? Because we have a lockdown between countries. And if we rely to one country to give us or to supply us products, we were being blocked during the pandemic. And here where the 3D printing and the local creation of products will led also the countries really to survive and to be out of this one with the sustainable economy. The seventh hidden aspect is the life science. And here where you see life science, biomedical engineering, and also bioscience is in this aspect, and is not highlighted is by purpose. We would like to make it more strong with this digitization working in the technology of healthcare and the technology of bioscience. Here, this is the different establishment at the science park, and you see is a very attractive science park here to see, and I will not answer to any question saying, I am looking for a job. I would like to answer the question, may I have a place here in the science park and work creating my company? This is exactly the aim, and biomedical engineering, and we'll go with some question to you will see the importance of having talent here and being part of the science park and working hand in hand with American University of Sharjah and other universities, and to be linked to hospitals, to government, and to private sector. I will stop here, but please, guys, if you are looking for a job, this is your time. I think being part of an institution is different than creating an institution with your talent. I hope the message is done.
Ahmed, would you like me to comment on the?
Of course, of course.
The question was about finding a job and being employed and all of that. And I think this is a very important question, and it's on the mind of many of the graduates. And I keep talking to even my students about this, that maybe we need to change our mindset. We need to change our approach to work. Yes, in the old days, students or graduates finished the universities and they immediately find employers. But nowadays, I think, and in the future, I think there will be more graduates than opportunities, you know, like available job opportunities by the government or by even the private sector. I honestly think that students should move more towards, as Ahmed said, more towards being innovators and come up with your own ideas based on all the education that you have, and invest more into entrepreneurship. This, of course, it's very easily, we can, easily say this, but how to implement this? I'm confident that the governments in the region are seriously thinking about how to facilitate the conditions for the students to become entrepreneurs. Training, of course, this is one, and now even universities and the Ministry of Education has actually asked all the universities to try to start teaching and training students on how to become innovators and entrepreneurs. Maybe one of the main challenges that is facing the people with ideas, the innovators, or even people with how can I say this, with inventions and patents. You know, we have an abundance of patents and ideas, which is really great. But the next step is, which is converting this idea or this patent into a product, into something that can be sold. We, frankly, as academicians, this is not our game. We're not good in this. Maybe we can work in the lab, we can come up with new ideas, new patents, but I find it difficult myself to market my ideas. We need another phase of expertise who are able to take these ideas and market them. We need also what they call venture capitalists, people who with money, who are able to invest in these new ideas and support our new brain, our new and young minds and young brains. So I think the conclusion of my talk, we have the ideas, where we are now investing more and more into education, but we need that segment of society that takes these ideas, puts some money in, hoping that after maybe 2, 3 years, 5 years, we will start having some reward. Thank you.
If I may add, I think that's where I agree entirely with Dr. Hassan. I think that's where the role of research technology and innovation park comes in. That's very nicely. I'm actually sold with this initiative. I think this is an excellent initiative. It brings together so many entities, so many stakeholders, because not everybody has a relevant skill set to cover everything, which is acceptable. So to me, bringing together industry link, or from the university point of view, under one umbrella, such as the Dr. Ahmad's Research Technology and Innovation Park, that is the future in my view. And considering that we are so closely located, more or less on the same campus, which we are ideally placed to make a major difference. So hopefully, I look forward to actually contributing majorly to this mission, and hopefully taking our products forward, because discovery not taken to the market is knowledge lost. To me, it is important that we need to translate this knowledge into something more meaningful, which can have impact.
Yes, true. Now, this exactly, I think it answered the biggest question about how we can go from a fundamental research to a prototype or to applied research, to prototype, and to go beyond that to commercialization, which means to create products. I think we have seen a lot of acceleration during the pandemic. And this was, thanks God, it was coming alone. I think if we program to do an accelerator program in biomedical on bioscience, I think we could take years to convince people to be part of this one. Thanks God that the pandemic was positive on the sense that the acceleration of the importance of bioscience and bioengineering, it came automatically. It came by nature. And here, I think this is a good time to start with. I sent from the chat the email info@srtip.ae. I'm not advertising. For anybody who would like to explore his idea and to evaluate his need to create his own startup in biomedical engineering and in bioscience, I think this is the right time. I think the market has a lot of need. We have seen a lot of demand from hospitals, a lot of demand from research centers about the talents. And here, this is the right time for you guys, okay, to show up and to show your competencies. Okay, now, what are the recommendations, Dr. Hassan, before I go to open the door to the audience? Your recommendation and the way forward about, first of all, about the program to attract more talents to be more in master degree and PhD degree, but also from the bachelor guys to be the competent people integrated to the market.
Yeah, I mean, as I mentioned earlier, I mean, with the three known layers of university education, the bachelor's, the master's, and the PhDs, they're kind of well defined with clear tasks to do. My emphasis at the beginning was on research and development, but obviously for our new talented undergraduate engineers, maybe, yes, they need to also start stressing and showing people who are they're working with the importance of biomedical engineering in their workspace. I have actually talked to many of those engineers, and they always feel that they have been somehow mistreated, if I may say. They're being at the hospital, they're not considered as, you know, clinical people. Therefore, they don't have the right level of integration, I would say. And my response to those engineers, you have to show how important you are to the doctor. You really need to show that with your ideas, with your new novel solutions, with your suggestions, rather than just being passive and waiting for something to happen. So you can take the lead. And I think, as I said in the earlier introduction, this pandemic showed the importance of biomedical engineers. I know that they were in the front line as well. They're working day and night in order to ensure that all the equipments and ventilators and diagnostic equipment are all ready and fully functional. Okay.
Okay.
Now, yeah. Carry on.
I would like to give some examples as startups already set up at the park, at the science park, working in biomedical engineering. We have a company is called NAPTA Healthcare. NAPTA Healthcare is led by women. This is for the aspect of healthcare of women, okay, women healthcare, which means they care about the pregnancy, about the whole evolution of women health, by using the latest technologies in mobile technology, artificial intelligence, machine learning. This company started less than 1 year, and they are listed one of the 100 aggressive startups worldwide by CNBC in last December. Imagine. I'm telling you why, because I think the company leaders are sharp, but also the topic is very sharp. And now, specifically with the pandemic, I think they have a lot of solution for the woman, I think, to fight against the pandemic or the COVID-19 specimen. Now, allow me to go to the questions, okay? I have a person, really, he's asking a lot of questions. I would like to give him credit. But before, I have Dr. Isa Bastaki. He's with us, the president of University of Dubai. Welcome, Dr. Isa. It's an honor to have you. Yes, you said basic research, research and development, research and business development. But we said fundamental research from the basic research. I think here, thus we go from fundamental to apply the research to prototype and to production. But of course, your comment is very valuable. I'm going to some questions here. The question is about the usage of artificial intelligence. I think by using machine vision, deep learning, and machine learning, we have seen that most of the tangible applications in the market are related to CT scan, to radiology, and to ultrasound. And which means here, a lot of radiologists and technicians have started fearing advanced medical information technology. Why? The fear is correct, or means this technology will replace them, or they will still be here and the technology will enhance? Dr. Hassan.
Yeah, this is, thank you, Ahmed. This is a typical question. I always get this question whenever we had these kind of discussions. I tell you what, maybe one person said it before. If a doctor accepts to be replaced by a machine, that's unfortunate. Doctors also have to evolve, since we are all in biology and we kind of somehow believe in evolution. We have to evolve as well. Our techniques have to evolve and have to develop and be up to date. And this integration, like I said at the beginning, we need more integration between engineers, data analysis people, medical doctors, biologists. We need that integration so that they can talk to each other to solve the problems. So the technology can be an assistant, can help rather than replace this doctor or that specialization or this specialization. So in other words, we can search for solutions by collaborating between scientists and doctors and engineers rather than developing a machine that replaces a doctor. I personally don't think that machines will ever replace doctors. Just that's it. I know there are robots now that can do amazing level of accuracy in surgery. You know, in surgery, robots are doing an amazing job. But medical or doctors or surgeons can use these technologies for their own benefits to improve the outcome of their surgeries as well. So they can use this artificial intelligence that we're talking about. They can use this artificial intelligence to make their diagnosis right first time. I mean, we all know about cases where the doctor will give you this medicine. If it doesn't work, he'll give you another medicine. If it doesn't work, he'll give you a third medicine. And then and maybe sometimes you are taking the wrong medicine for the wrong disease. Artificial intelligence may help to resolve this dilemma and give you the right medicine first time and be treated. So yeah, I mean, artificial intelligence, I think it's here to serve experts and specialists, not to replace them. That's my answer.
I can add something here. That I think that people, they deny a little bit the role of the second opinion. In medicine, I think second opinion is very important. Why? Because human being, I think the diagnostics are not coming accurate from the first time. That's why you need a second opinion, specifically if you have critical health situation and you have to be more safe or more sensitive about what you should do with your body or with your health. Here where artificial intelligence, I think, will play a big role of second opinion, not the first opinion. First opinion is much better to have this eye contact, to have the psychological aspect and the exchange of emotion between the doctor and the patient. This is, we cannot deny this one. Machine can't do this one. Yeah. Even we have a lot of researchers in emotional technology by using artificial, but will not replace doctors.
Absolutely, absolutely.
Second opinion, yes. Here, I think the machine can go beyond the human second opinion and give more accurate opinion about the situation of about the case, I think here. And here, this is where I will be more than happy to ask a machine for second opinion and asking a human giving me the same rate as the accuracy of the first opinion. You see here. And we have seen a lot of improvement. I think in breast cancer, a machine can be accurate in detecting the breast cancer in early stage in 94 to 95%, which is very high compared to 65% from human human expert diagnosis. A second question is computational modeling, doctor, simulation, product design, validation. They are part of biomedical engineering, and also they are part of electrical engineering and computer engineering, okay? Yeah. Are they a part of, okay, a student, for example, or a graduate to go to the market with these competencies, or he has to be more bioscience, okay, to attract a job in biomedical engineering?
I'll maybe, Dr. Naveed, I think, start, and then I can answer.
Yes, yes, Dr. Naveed.
Okay, yes, may I request if you can just repeat the question, please?
The question is about the competencies. I think here in biomedical engineering, it's integral part of electrical engineering, which means they have more competency in electrical engineering than the bioscience. But when they are going to look for a job, I think here they are asking them more bioscience competencies than the electrical engineering. Now, how the balance will be and what the future, I think here, this is a good opportunity that we can talk about.
Yeah, absolutely. I think this is where that the future lies, in my opinion, because problems are multi-dimensions, and so solution have to be multi-dimensions as well. And it's unfortunate that over the course of the history, the majority of the training program that we had at our disposal were very discipline specific. But recently, program within the UAE as well as at the AUS, they are becoming more, involving more multiple disciplines, especially from biosciences and bioengineering, biomedical engineering point of view. So I think taking advantage of those programs will allow members, colleagues, students to be specialized, not just in one discipline, but also take advantage of other disciplines as well. So I think that's where the future lies, that if we have training programs which are not discipline specific, that will allow any member to look for job opportunities where they will feel that they're a better fit for that application or for that particular company or hospital or any other sector. So to me, that should be the future.
Excellent. I think we are touching the end of this webinar. I would like really to thank Dr. Hassan, Dr. Naveed for this excellent insights. I hope it's very useful for the audience to learn more and even from the expert in the domain to learn more about the entrepreneurship opportunities in this regard and the importance of this domain. I think here.
I have a question. I have a comment, please. I noticed, yes. I noticed there are many questions and many of them are kind of technical as well. So yes, maybe yes. if they can send emails to me or to Dr. Naveed yes. With these questions, and I'll be more than happy to address them one by one and talking directly to the individual.
Oh, thank you very much. And I already sent them the email. They can send their inquiries and we will follow up, inshallah, with it. Okay?
Great. Thank you.
Thank you, Dr. Hassan, for the insightful presentation and information, like usual. Thank you, Naveed. I think that what you have done, it's a very, very helpful. And a lot of people, they don't know that the bioscience is very well developed at American University of Sharjah. Even they don't have medical college, but they have an excellent department here, which are dealing with bioscience development. Okay, thank you for the audience, and I hope to see you soon, inshallah. And take care and be safe. Thank you very much.
Thank you. Thank you. Have a good day. Bye-bye.
Thank you. Bye-bye.